Yes.
Very much.
Sir,
Well,
sorry for interrupting to you. Basically, there was one event which our team has been left. There was a proceeding. Basically, we want to release our proceeding, but no issue, sir. After the completion of this session as a keynote speaker talk, we will release our proceeding, sir. Okay, and then we will start our second keynote speaker session, sir. Okay, sir.
okay.
Yeah. Thank you, sir. Please proceed, sir. Thank you.
Okay, can I start? Okay.
Of course, sir. Yeah. Please, sir. Proceed.
Okay. Well, this is a research that we are following in the University National Mayor of San Marcos. This is with the research group IT Data, where it is the research group where I belong. So this is a smart medical prescription system using fuzzy logic for various diagnoses. Okay. This is the paper that was presented in the journal of the university. Here are the authors. As you can see down, there are two Indian participants, Dr. Veera Magnikan, RM, and Dr. Vikas Kular from Chitara University also collaborated with this research. Also, Professor Ulises Roman, who is the coordinator of the research group, and Carlos Chavez, Pablo Romero, Carlos Navarro, and Fabricio Mayor, also members of the research group. I wanted to introduce, before to go to the main of the research, that Peru and India are two countries that we are with a very high distance. We are so far away. And so, but we have the same problems that we need to solve. We have the same problems about health. We have the same problems about transportation. Okay, we have the same problems about the poor people. We have same problems about crime. Okay, and we have many similar problems. Okay, so with this kind of problems, we can also solve the barriers of technology, trying to collaborate each other, because we have the same expectations on research, the same expectations of solution of problems, and we have the same expectative to solve this kind of problems. Peru is a country that have three very areas, okay, that we call regions. That is, one is the yellow region is the coast, okay, and the orange region is the land, okay, or highland, and so the green color is the jungle. So we are very, very happy to have many kinds of climes, the weathers, and also people cultures that where we can interact. But almost in the big cities like India and Peru, all the main power is concentrated in the capital. Okay, but so the faraway zones like the jungle and the highlands, okay, maybe are poor peoples that are suffering about hungry, are suffering about cold, okay? The weather also sometimes is very, very hard. It's cold, very cold, that do not uh, give permission to them to to resolve this kind of problems as education also, okay, the limitations, okay. And so we saw that in these remote areas, there are people that have no uh, possibility, have attention of the medics, of the physicians that can help the people that is sick and suffering some problems. And also we do have all the medicine that can help them to to have a better health. So we saw that it's important to have a system that could seek and improve access to and control the medicines, especially in these remote areas. So it guarantees the safety, the efficacy, and quality of medicines, and prevents the circulation of counterfeit, okay, or speeded products that also used to cure. So it covers prescription by health professionals, dispensing, and final consumption in pharmacies, following national guidelines and regulations. Okay, so it is based on national policies, okay, to regulate the prescription, dispensing, and consumption of the medicine. So one of the problems that we can see in these kind of regions, okay, is the how to can uh, give or have medical diagnosis that can be very precise. Okay, so many of these diagnoses are have imprecisions or are inaccuracy, which has claimed the countless lives. So we saw that an expert system is beneficial in the identification of any medical condition. So classifying various disease or illness in this main purpose of the system, when an expert system that collects information, okay, learning from any physicians or specialists, okay, in the with a knowledge base, okay. So when expert system produce a result for a particular condition or an issues that match the results that is given by the doctor, so the system is considered accurate. So when an expert knowledge acquisition is essential to developing this system to expert for a medical condition. Okay. So there are levels, okay, of clinical decisions for making a system. Okay, so it can be a system based on knowledge or a system based in no knowledge. If a system based on knowledge will need a rule based, and we can use a physiologic, okay, to reduce the uncertainty, okay, because many of, of the diagnoses are imprecise, so they need to find in this knowledge-based system what is the real, okay, what is the real disease that a person have, where there is available a doctor, okay. So with other not only system-based, use genetic algorithms or neural networks also. So when we are developing an intelligent system, we can use a classical rule based that can approach the encodes knowledge using the antecedent and consequent structure. As we can see, the antecedent and consequent structure is based on the transaction data, okay, and the a priori algorithm that can use it to identify, okay, previously what are the previous transactions that we can process. Okay. So the rules whose antecedents match the data and vary are defined in the consequent clauses. Okay. No new rules can be fired until the intended, okay, action is achieved. So in recent years, the fuzzy logic has emerged as a valuable technique for intelligent medical systems that is a subfield of artificial intelligence. So fuzzy logic is one of the models of algorithmic models and technologies developed to achieve the accuracy and precision of the computers were invented. So results, we can have the numbers of patients dying in hospitals on a daily basis has been significantly reduced. So fuzzy logic is an effective tool for decision-making mechanisms like expert and pattern classification systems. The application of fuzzy logic are in environmental control system, business rule engine, and automobiles and medicines, aerospace, natural language processing, dishwashers, chemical and copy machines. But the most important of the application are the benefits and challenges that have the fuzzy logic. For example, the advantage are the flexibility, the simplicity, the fault tolerance, the speed, the reduced complexity, and the disadvantage are the subjectivity, okay? Because we have to find between 1 and 0, okay, what is the value that we can take to take a decision. So the lack of transparency also, and the difficulty in optimization and limited applicability and computational complexity. So in the research analysis of the literature, okay, we can find many authors that use the fuzzy logic, okay, as trying to get a good results. For example, kidney failure can have an adaptive neural fuzzy algorithms that outperform the fuzzy intelligent machines in terms of output quality. Okay, for example, in diabetes also, diabetes is on a high accuracy of 96% using fuzzy logic. For COVID also was used for detect the patient's symptoms to determine the probability of COVID. And there are many products also that use fuzzy logic. For example, Dr. Moon, knowledge base, knowledge acquisition, patient database, and also are available and managed by the Delphi, for example, Borland paradox of Binitil, okay, or machine record information. So as methodology, we found that it's very important, okay, to have the opinion on a doctor, okay? So the opinion of a doctor is very important when a patient in remote area, okay, is far away, he has no all the information available, okay? So we try to develop a system that it can be inside a database and can be controlled remote by an application. Okay. This application can also use IoT devices that can measure, for example, pressure, okay, temperature of the patient, okay, and also have a camera that can also detect and see what are the symptoms of the patient. For example, the color of the skin is very important for physicians to have a good diagnosis. Look the eyes, okay? Look the movement of the hands also, okay? So there are many important evidence that the physician have to take. So in this study, we include people in remote locations, okay? Healthcare professionals and health department of authorities in various parts of the Peru. So it will help to identify barriers of to accessing health service. So all vulnerable areas are covered by these smart applications, device, and diagnosis, okay, that can detect some issues with the persons that live in these remote areas. As methodology also, we construct a device, okay, with uh, these components, okay, that with assembly in a product with a hardware, when we can take the pressure, okay, with a sensor, the blood pressure, use a HD endoscope camera sensor, okay. Also, we can have a microphone to hear, for example, the breath of the patient for taking a decision, okay. Also, we use these layouts components to uh, use with Arduino, okay, in a system when we have also the oximeter and heart rate, okay, because it's very important uh, to classify a patient, okay, and to know what is the uh, how strong is the problem that he has. And also, in this methodology, we proposed this use physiologic model for a medical diagnosis. This model is based on diagnosis to deliver an optimized output for medical prescription, such a model system to in the industry 4.0. So the most important part is reducing the work of pressure to handle more number of patients in urban areas also by employing more physicians with a smart application usage. So in this first phase, it's about how fuzzy model logic works with different sets of inference rules. The inference rules are very important because they can process and help to take the best decision. So the second phase is about the smart applications working with the model for medical diagnosis system within architecture dia. So we have in this model, in this architecture, we have the an input parameters, we have the fusifications, we have the rule based, okay, and we have also the inference engine, okay, and we can diffuser, okay, to create the output, okay. In the output we obtain a specific diagnosis or a set of possible diagnoses with their corresponding probabilities that support healthcare professionals in making informed decisions about the patient care. Um, so uh, to work on this, we working in block diagram, okay, of the prescription system, where we have here the sensor of temperatures, heart rate sensors, okay, and we process in this Raspberry hardware. Okay, we communicate with a web server for decision making. Okay, so we can give a medication dispensing system when we have here the medication system. Okay, and the medication dispenser is also for the basic medicines that it can be delivered to these persons that are in these remote areas where there is no all the services, medical service that can help to save the life of them. Because a patient can die just by very hard pain. And if this person has no the adequate medicine, okay, it can suffer, okay, because no resist the heart of the pain. So to implement the results, we use a React JavaScript that is used to develop a dynamic and interactive user interface, okay, where we have here, we can, it's like a clinic story, okay, where we can register all the data of the patient, okay. So this information is collected and sending to a physician who can also give the diagnosis, okay, with a pre-diagnosis that the logic system with Fuzzy Logic has previously solved. So in this system, we use basic information. For example, the age, the gender, that is very important. Okay, email address, because the physician that is far away in another remote area can send the information. Okay, so medical history, okay, is very important. These questions, we work at this with physicians that give us all the information, very important for the first stage of classification of a patient, okay? So we also collect the lifestyle habits, okay? So if it's a smoke, is consumed alcohol, and general health also, how to can be taken. So we also worked on a script on Python to evaluate the rules. Okay, each one of the rules evaluate and show all the implementations of the rules in the system. Okay, to take a decision with these fuzzy rules of the reference. Okay, so we working all the process, all the information, and took many of the results, okay, that could be evaluated by the system. Okay, so we can do evaluate the four parameters range in low, medium, high, or a good efficacy of the results. Also, we worked in these remote areas in Minas, okay, where we worked with the implementation of this device, where is the faraway people, poor people that is living in these remote areas. So, a conclusion, we can conclude that developing this medical physiologic system can revolutionize the disease diagnosis in healthcare. So also we can reduce the uncertainty and imprecisions of the diagnosis, and we can have the key components of the input parameters of fusification of data, and with the developing on an expert knowledge. So despite the advantage, okay, implementing the fuzzy logic in medical diagnosis presents a challenge. And because this includes a lower computational power than some machine learning models need for assumption of the results. Okay, So we have many reference and many thanks for your attention. Thank you very much.
Thank you so much, sir. I would like to ask anyone. If anyone have any query, you all can ask. Also, thank you so much, sir, for the valuable presentation.